Good morning, everyone, and thank you for joining us today for the presentation of Saskatchewan's COVID-19 vaccine delivery plan. In the radio room in Regina, we have Premier Scott Moe and Minister of Health Paul Merriman. Following opening remarks, the Premier and Minister will leave. We'll do a quick sanitation break, and then we will have Chief Medical Health Officer Dr. Saqib Shahab and SHA CEO Scott Livingstone join us for a technical briefing and questions from media. Also joining us over the phone line for technical questions is Andrew Will, SHA Vice President for Information Infrastructure and Support, and Dr. Tanya Diener, Medical Health Officer for Immunization with the SHA. We'll go to Premier Moe for opening remarks.
Well, thank you, and good morning, everyone. My notes say good afternoon, as we were to be here yesterday afternoon, but we've been slightly delayed in what is a turning point in our response to the COVID-19 virus. I want to thank you for joining us here this morning, and I want to begin today by expressing my deepest condolences to the family and friends of each and every one of the individuals that has passed away over the course of the last number of months due to COVID-19. We are very sorry for your loss. We remain particularly concerned with the ongoing outbreak at Extendicare Parkside in Regina. Our health officials are taking all necessary action to care for the residents in that facility. Today, we are pleased to provide more detail about Saskatchewan's COVID-19 vaccine delivery plan. The Minister and myself are going to excuse ourselves in a few moments and let the health officials take over this presentation to explain Saskatchewan's plan for the safe and efficient delivery of the COVID-19 vaccine once it is available. And I want to say that we have full confidence in that plan. And Saskatchewan people can also be confident that we will be ready to go in this province as soon as the vaccines are approved by the federal government and delivered to Saskatchewan. And there's some good news on that front, as I understand that just in the last number of minutes, the Pfizer vaccine has been approved by Health Canada today, and now we expect to begin receiving those vaccines more quickly than we had originally anticipated, and receiving them in slightly greater quantities than we had originally anticipated. Our vaccine delivery plan will start with a pilot program of 1,950 doses expected to be delivered by December the 15th. These very first and early doses will be delivered to and administered at the Regina General Hospital. Healthcare workers providing direct care to COVID-19 patients are going to receive those first doses. We then expect phase 1 of the vaccine delivery plan to begin later in December, with Pfizer expected to deliver 10,725 doses per week. We also now expect Moderna to begin delivering vaccines very early in 2021. The weekly number of Moderna doses is still being finalized, but we do expect that total deliveries in the first quarter of 2021 to be about 202,000, enough to vaccinate 101,000 people in Saskatchewan. As the Minister had said last week, vaccines are the finish line in this very long fight against the COVID-19 virus. This is how life will get back to normal once we have delivered a safe and effective vaccine to a significant portion of Saskatchewan's population. Just like everything else when it comes to fighting COVID, we all have a role to play, as we all have had a role to play. The federal government's job is to approve the vaccines and to provide them to us as quickly as possible. Our provincial government's job is to ensure that our provincial health system has all of the resources that it needs to deliver the vaccine to the people of this province as swiftly, as safely, and as effectively as possible. The health system's job is to deliver that vaccine throughout the province. Our health system has a great track record when it comes to vaccination programs, and there'll be more on that in a moment. And each of you have a job as well. And your job, the people of Saskatchewan's job, is to get the vaccine when it is your turn to do so. We all need to do this. Just like we all need to follow the public health orders and the guidelines that are in place to keep ourselves and to keep others safe. We all need to get vaccinated to keep ourselves and to keep others safe. Even if you aren't worried about contracting the virus yourself, do it for those around you. Do it for our seniors, our parents, and our grandparents, who are the most vulnerable to very serious outcomes from COVID-19. Do it for our healthcare workers, in our long-term care homes and our hospitals. Do it for our teachers and our students throughout this province in our schools. We all need to get vaccinated, not just for ourselves, but for others and for those around us. It is the Saskatchewan way, and it's how we will protect those that are around us, and it's how we will ultimately get our life back to normal. Once the vaccine is approved by the federal government, and my understanding is the Pfizer vaccine was approved minutes ago, we will be ready to distribute that vaccine as soon as it is delivered to this province. We look forward to starting that as soon as possible. Until then, our message is the same. Continue with your physical distancing. Continue wearing a mask where it's required. Continue to reduce the number of contacts that you see and come in contact with each and every day. Stay home if you're feeling ill, and follow all of the public health orders that are in place and all of the guidelines and recommendations that are there to protect us and to protect our families. Thank you so very much to each of you for all you've done, and thank you in advance for what we have yet to do. Minister Merriman.
Thank you, Premier. The province-wide delivery of a safe and effective vaccine will be a massive undertaking. The good news is Saskatchewan has a very strong record when it comes to immunization, both in terms of wide-scale delivery of vaccines and in terms of uptake from Saskatchewan people. Every year, we have a very robust influenza immunization program, delivering the flu vaccine in every part of our province. We have one of the largest rates of uptake in the country for the flu vaccine, increasing from 27% in 2013 to 33% last year. In our long-term care homes, 87% of the residents received the flu vaccine last year. Saskatchewan has an extremely strong program of participation rate for infant and childhood vaccines, with uptake of around 90% for many of these various vaccines. In addition to these ongoing vaccination programs, Saskatchewan also had one of the most successful programs for the delivery of the H1N1 in 2009. As you may recall, that program followed a prioritized delivery model, just like we are doing for this vaccine. In that case, young children and pregnant women were the highest risk groups, so they were vaccinated first. Of course, this vaccine will have a very different order of priority. I would note that Dr. Shahab was very involved in the design and delivery of that successful vaccination program, back when he was the Deputy Chief Medical Health Officer. So our health system has a very strong record when it comes to immunization. But this will be a bigger job, to be sure, both in terms of scale and complexity. But we don't have to reinvent the wheel. We've done this before, and as the Premier said, our government is prepared to dedicate all necessary resources to this massive effort. Financial resources, human resources, logistics, whatever is needed to get the vaccine delivered swiftly, safely, and efficiently as possible. I am confident that our healthcare system has a strong plan in place to do just exactly that. When the vaccine will be ready, we will be ready. With that, I'd like to invite Dr. Shahab and Scott Livingstone from the SHA to present the plan. Thank you.
Thank you, Premier. Thank you, Minister. We'll take a short, brief break just to sanitize the surfaces, and then we'll have our next presenters come out. Thank you for staying with us during that brief break. Now presenting Saskatchewan's COVID-19 vaccine delivery plan is SHA CEO Scott Livingstone. Dr. Saqib Shahab will also have some brief remarks following the presentation, then we'll have time for questions.
Thanks, Jim. Good morning, everyone. I'd like to start by expressing our deepest condolences to those individuals who've passed away and their families from COVID-19 over the last 48 hours. As you know, yesterday was the highest number of deaths reported in a single day in Saskatchewan. Again, this should be a reminder to people across the province that the virus has real consequences to our neighbours and our communities. It's important for us all to follow the public health orders and recommendations in order to actually help the SHA contain this virus on an ongoing basis. So just before I start the presentation of the vaccine delivery plan, I know Dr. Shahab has a few opening remarks.
I will go after the presentation.
Okay. So we're going to go right into the presentation. So what I'm going to do over the next few minutes is talk about the vaccine delivery plan and ensure that everyone understands that we are ready to receive that vaccine and deliver the vaccine. So just an outline of the presentation, I'm going to talk a little bit about the vaccine itself, some of the core principles and timelines around the phased-in approach, some about logistics and distribution of the vaccine, because we've heard lots about that in the media, and I'm going to clarify some things, as well as the communication plan throughout the delivery of vaccines across the province. So just to begin, we've heard lots about the Public Health Agency of Canada, and they have established agreements with a number of vaccine manufacturers across the country and the world to ensure that Canadians have access to the COVID-19 vaccine. As you've already heard, we anticipate the vaccine will be delivered across Canada in multiple small quantities starting this December. Initially, there's going to be limited quantities of the vaccine available to each province, and as such, each territory will receive a per capita allocation of the vaccine from both Pfizer and Moderna. These vaccines, as you all know, require a 21-day or a 28-day booster dose following the initial injection. Some of the core principles and timelines around the vaccine distribution plan were that all vaccines approved by Health Canada are equally effective and safe. And as soon as Health Canada approves the vaccine, as they did today with the Pfizer vaccine, Saskatchewan will be ready to deliver. As we know, the Public Health Agency of Canada has also indicated that vaccine may begin to arrive in Saskatchewan in the beginning of December, with further shipments on a weekly basis after that. Vaccine arrival will be somewhat dependent upon the manufacturer's ability to produce the vaccine, as well as any issues they may face in the manufacturing. So, as you heard the Premier talk about, there is a phased approach to our plan of vaccine delivery. We do have a long history in Saskatchewan of immunization, and we're going to use that infrastructure as the backbone as well to start our COVID vaccination program. Our vaccination program starts with a pilot phase next week on December 15th, which you've already heard, which will involve 1,950 individuals that are working inside acute care facilities in Regina as a start, and then moving into phase 1. Which will begin in later December, which is targeted immunizations for priority populations, as well as a planned immunizations of over 202,000 doses. Phase 2 is expected to begin later on in April of 2021, which will continue with the priority populations if we haven't finished them up at that time, but also include widespread access to the immunization for the general population. The timing of phase 2 could occur earlier if vaccines are made available to us earlier, but we will be responsive to that, and as the plan has the ability to scale up within each phase. So let's talk a little bit more detail about the pilot on December 15th. So as you've already heard, we will be participating in a pilot using the Pfizer vaccine, the ultra-frozen vaccine, next week, including 1,950 individuals that will be vaccinated. It's a planned immunization of healthcare workers with using the Regina General Hospital as the base. The first recipients of the vaccine will be healthcare workers in our intensive care units, emergency rooms, our COVID units in Regina, and Pasqua Hospital, Regina General and Pasqua Hospital, as well as those individuals we have from the SHA working in our testing and assessment centers in Regina. Pilot recipients will receive their second dose 21 days following the administration of that first dose. We will have the ability to move phase 1 if more vaccine is received in a more timely fashion. Moving on to phase 1, which is our targeted immunization. Again, this will start later in December and will be tailored to a Pfizer delivery schedule of 10,725 doses per week. Just reminding folks that each of the vaccines we will be starting with will require 2 doses. The allocation of the Moderna vaccine needs to be confirmed, but we do estimate that over 202 doses from both vaccines in the first quarter of 2021 is anticipated, and we will, I'll share in a moment where we're going to be targeting that, but it will be immunization of priority populations, including healthcare workers, long-term care residents, and vulnerable populations. We also expect the Public Health Agency of Canada on an ongoing basis to update us regularly on vaccine availability and shipping dates and volumes. And as the plan is flexible and our communication strategy is as well, we'll make sure that the public is aware of what's happening with respect to the program as it evolves. So with respect to the prioritization framework, let's talk a little bit about who will be prioritized in the phase 1. So there's a National Advisory Committee on Immunization which has issued guidance to all provinces across the country for the distribution of the COVID-19 vaccine. Our Chief Medical Health Officer, who's with me today, has reviewed these guidelines and modified them based on the applicability to our province, both our demographics and the logistical requirements of transporting vaccine across Saskatchewan. So the priority framework for administration of vaccine is going to look like this. So priority 1 will be our long-term care and personal care home residents and staff. And there are some estimated numbers of the individuals that will be impacted and offered the vaccine in phase 1. Priority 2 will be healthcare workers, continuation of vaccinating health emergency department, intensive care units, our COVID-19 wards, and our testing and assessment centers across the entire province. And then moving into phase priority 3, which is residents 80 years of older in all communities across the province, and then moving down in age, so age prioritization 80 plus first, then 75 to 79-year-olds, 70 to 74-year-olds. And again, the numbers of each province-wide are on our slide. And last, but certainly not least, is residents over the age of 50 living in remote and northern Saskatchewan will also be prioritized for the first phase of vaccination across the province. Phase 2 of the program is widespread access. This is anticipated, as I've already said, to commence in April of this year, and we will continue likely to priority population immunizations at the same time if we don't have them completed in the time period of the first 3 months of the year. Distribution will occur throughout the province at public health care clinics and vaccination delivery sites. And to give you an idea of what we mean by vaccination sites, depending on the vaccine flow, the goal is for all residents in Saskatchewan to receive the vaccine where they live or where they work, similar to how we try to deliver our flu vaccine. Vaccinations will be done in long-term care and primary care homes in phase 1. In phase 2, the mass immunization clinics and also using primary care providers, nurse practitioners, and pharmacists to distribute the vaccine in a wider distribution across our province. Of course, our plan is dependent upon vaccine availability, both receiving more vaccine in a timely fashion, but in the event that we don't receive what we're expecting, we will have the ability to sequence some additional priority populations, but we'll be making those decisions as we move through this phase of vaccination next year. The planning and redeployment, there's lots of work going on around how we support the vaccination program, and we've already started working with Public Service Commission staff to support the administration tasks associated with data entry at our vaccine sites. We're training PSC staff as early as next week to start possible rapid readiness to prepare us for the readiness that's going to be needed near the end of the month. Again, some caveats, the plan is dependent upon vaccine ability, but I wanted to make sure that people understand the message is we will be ready. If the vaccine is in Saskatchewan, we will be ready to administer to the residents as per the plan. Some issues around logistics and some of the key details. As you know, both the Pfizer and Moderna vaccines have some cold chain requirements. The Pfizer vaccine is what's called an ultra-low temperature vaccine, so it requires to be stored at -70. Moderna vaccine is required to be stored at -20. So we are doing some work now to establish the logistics around how we distribute that safely across the province so that we can take the advantage of the vaccine as soon as possible. So there are freezer and equipment that has been ordered through a task group that's been in place for a number of weeks. And as well as we will receive an allotment from the Public Health Agency of Canada for 7 regular freezers as well as 1 low temperature freezer. Ministry of Health has also procured and is awaiting the delivery of 25 portable ultra low temperature freezers to assist with vaccine shipments across the province. And some additional freezers have also been purchased for the Moderna vaccine. So these are important components of the logistics and the distribution of the vaccine, but I also want to point out that there are freezers of this nature in our province today already. So if there is any concerns with the supply of these types of pieces of equipment, we do have per se, I guess, a plan B, because we do have low temperature freezers in our province already that are used in universities and labs across the province, so that we will take advantage of that if necessary, but it's unlikely that we'll have a challenge. So lots of internal planning and preparedness has been going on with respect to the vaccine plan, and I just wanted to highlight that there is a vaccine steering committee that oversees the immunization planning committee, which represents a large number of organizations who are listed on the slide, so that we are ensuring that our partners across the province are aware of what's going on with the vaccine distribution. Beyond the immunization planning and the working groups, there's a number of different groups that will deal specifically with vaccine administration, also providing support for timely and reliable data collection so we can ensure that individuals are getting their second dose on time, as well as evaluating the program, any concerns that might be around safety that we may see, and certainly we will actually be looking at how we adapt on the fly if we are receiving more vaccine that was originally planned for, so that we can adapt the program so that we can assure the vaccine program continues at a pace for the province that gets us to our long-term goal of obliterating the virus as quickly as we can. With respect to immunization administration, Saskatchewan has had a robust information system for vaccination registration and immunization registration called Panorama. The Panorama system records all immunizations for Saskatchewan residents. We will be using this system to prepare vaccination administration across the province, and it will support and remind residents to follow up for their appropriate second dose when it is required. Individuals who receive the COVID-19 vaccine will receive a record of both their first and second vaccinations. So from a communications plan, these are the last few slides. I just want to make sure that it is our goal to provide accurate and timely information throughout the vaccine delivery program. It will include weekly public briefings to provide updated information, as well as daily updates through news releases. And last but not least, we will have a web page up and running, so Saskatchewan residents and individuals will be able to go there to get the information they need as the vaccination process proceeds. The campaign also includes a significant public relations campaign. We want to make sure people are aware of the importance of getting vaccinated. We will use all available channels to do that, and the campaign is going to be focusing on, again, providing accurate and timely information about the safety of the vaccine and where we are with respect to the phases of our vaccination program, and increasing public awareness of the importance of getting the COVID-19 vaccine. The campaign is going to begin this month, and it will be built around our phase 1 vaccination strategy. So again, I touched on this a little bit, but the communication focus is going to focus on the safety of the vaccine, ensuring that there's accurate information out there for individuals and most timely information as the world starts their vaccination programs. Also, what prioritization groups are up and getting vaccinated at the time, and as well as what's happening next. We will also need to maintain, and it's important that folks understand, and this will be part of the communication process, is starting the vaccination process doesn't mean that the other things that we're doing today to help mitigate the impact of the virus on our population, they need to continue until such a time that the vaccine has done its job across the entire population, and that will take months. But the vaccination is absolutely critical to us returning to our new normal. So with that, I'm going to pass it over to Dr. Shahab for some comments, and then I think I have a few comments after Dr. Shahab.
Well, thank you, Mr. Livingston. So I'll just maybe go over a few numbers today and just a few opening comments. Obviously, the focus today is vaccines, which is very exciting, but I did want to just provide an update on COVID-19 generally. So we will be announcing in the news release later the numbers for today, which are 302 confirmed cases. So again, as you can see, we had 183 yesterday, 302 today. So we always want to look at the averages. So our 7-day average still is around that 264 mark, 21.8 cases per 100,000. So again, it's still remaining high. It's not going much higher quickly, which is what we feared, but it's also not coming down. It's staying at that between that 250 to 300 mark. Our test positivity rate is also staying at that 8.5% mark and trending up slightly. And as you all know, because hospitalizations and ICU admissions lag 2 to 3 weeks behind cases, they are still trending up. So I think there's some hope for optimism that we may be plateauing, but obviously also some concern that obviously hospitalizations and ICU admissions are trending up. And of course, we can never forget the tremendous impact COVID-19 is now having in our province in terms of long-term care and personal care homes. Regina Parkside now has 11 deaths reported, Saskatchewan Lutheran Home 7 deaths reported. So again, we did not see quite the impact that other jurisdictions saw till now this fall and winter. But this absolutely underscores why we absolutely need to protect from the public health side by keeping our numbers low and by following all the protocols when we visit family and friends, and especially those who are more vulnerable. And right now that is not possible, but at all times we need to protect the most vulnerable through all these public health measures by keeping our numbers low and additional cautions around people who may have high risk because of age and other comorbidities. And secondly, as the vaccination proceeds, starting with the most vulnerable and frontline healthcare providers who care for the most vulnerable, hopefully, like Mr. Livingston mentioned, through it takes 2 doses and then another week or 2 to get protection. Vaccinations are starting December, January, continuing in the first quarter. So hopefully by February, March, April, we'll see the benefits of vaccine protecting to some extent the most vulnerable. And then as vaccination starts in the community, starting with 80 plus in the community and then working downwards, in 5-year age decrements, hopefully by April, May, June, we'll see more people at risk getting vaccinated. And then, of course, later in the summer and into the fall, all of us will be able to get vaccinated. And that is the way we will, come out of this pandemic. But till such time, I think, again, while vaccination is very exciting, we do need to, practice all the public health measures throughout. The vaccination program is going to be coming in small, consistent batches, and we are ready to administer as much vaccine as we receive. So, on our side, we're ready to administer in a very well-organized way, as you heard, any vaccines as they come, but, it will take some time, and we need to be patient and continue to reserve all public health measures, and especially, the measures we have currently in place, which include mask use at all times, unable to visit each other between households. It's very tough. It's going to be hard during the holiday season, but it is essential to keep our numbers low and allow the vaccine to start protecting the most vulnerable initially. So with that, maybe I'll stop and we can take questions as well.
So just before we go to questions, and Dr. Shahab covered a lot of the things that I would have in my closing remarks, but I just want to add, we've talked time and time again about the Saskatchewan Health Authority response to COVID, both our offensive and defensive strategies, and today is certainly one of the most positive days we've had with our journey with the COVID pandemic and the announcement of the vaccination program and getting it out across this province as quickly as we can is a really good piece of news, but it doesn't stop us from also doing all those things we've already doing and doubling down on how we support the healthcare system, because beyond the work we're doing today to try to contain, mitigate, and delay the virus, the vaccination program will require a focused effort on behalf of the Saskatchewan Health Authority and our partners, and we want to make sure that the system has as much flexibility to do that over the next few months and adhering to all the public health orders and doing everything we know that we can do, and we already have done to flatten the curve with this virus. We'll have to continue doing that over the months to come so that we can be as successful as we're intended to be with both our vaccination program, but protecting those most vulnerable in our communities.
Thank you, Mr. Livingstone. Thank you, Dr. Shahab. We'll go to our room for the first question. Adam, do you have a question?
Dr. Shahab, are you concerned at all, and you kind of touched on it there, that the news of the vaccine will give people a false sense of security about what they can do and their behaviors over the next few weeks and months until they get a vaccine? And what's your message to people as well who are maybe nervous about the vaccine?
Yeah, no, I think that's an excellent point, and that's why both Mr. Livingston and me were underscoring the fact that the vaccine is really good news. We can't underestimate how good of a news it is, and what a remarkable achievement it is for us to have a vaccine. 10 months into a pandemic, but it will take time, starting with those at highest risk. And it'll be delivered as soon as it comes, but it will take time to protect the most vulnerable first, and then over time, the first quarter is for the most vulnerable and individuals providing care to persons with COVID, but then by the second quarter, others at higher risk. So absolutely, we need to stay the course with our public health measures throughout the first and second quarters of 2021. And it's hard, it's tiring, we're all tired of that, but we absolutely have to stay the course.
Yesterday, Alberta announced some more measures. The premier there said they needed drastic measures. We're second behind Alberta in per capita cases. We've passed Manitoba now. Are you considering or going to recommend anything further before the holiday season to prevent further transmission of the virus?
Yeah, so we are monitoring our case numbers and our settings of transmission very closely. We're obviously monitoring the interventions we have put in place and their impact, and the interventions other provinces have put in place and their impact. Any intervention takes at least 2 to 3 weeks to start having an impact. And so, like I said with my numbers, on a positive note, we are not having 500, 600 cases a day. We're stuck between 250 to 300. Which really speaks to the efforts all people in Saskatchewan are doing to minimizing transmission. I think that's having an impact. We continue to see transmission, obviously, in workplaces and other interactions among individuals. Also, right now, if you live in a household of 5, you should not be meeting anyone else socially. If you live on your own, you can meet one person, the same one person consistently. And we really hope that people will, continue this. And with our current numbers, I think even over the holidays, it's really hard. Christmas and the winter holidays, and with Hanukkah and other religious events coming, it's traditionally time of being with family. But I think with our current case numbers, we need to stay apart but remain connected by other means. Obviously, with the mild weather, a lot of people are outdoors, like in the spring of this year. And that's, again, good to be outdoors, and it's safe to be outdoors and maybe meet and greet people from a distance, go for a walk. But sharing of things, even outdoors, is not something that I would recommend. And certainly meeting between households right now is not allowed indoors. And we really need to stay the course because, with all the restrictions we have in place from the 27th of November, universal mask use, the slowdown in retail, the slowdown in bars and restaurants, we think we are managing to keep case numbers low. We do want to see them trending downward, and we absolutely don't want to see transmission over the holidays resulting in a January rebound, because if our case numbers remain high or start rising, then we may have to look at further restrictions. But hopefully we can manage with what we have currently, but we will have to make some decisions next week on that. Thank you.
We'll take our next question from the phone line.
Phil Tank with the Star Phoenix.
Yes, I'd like to ask, how long do you and what restrictions do you think will remain after we start immunization of the general population? Once that starts, like phase 2, what restrictions do you think will stay in place? Like, will we still be wearing masks in public spaces? Will we still have restrictions on gathering sizes? What is that going to look like?
So I'll give you my very high-level view, Phil, but obviously some of the details will emerge in terms of what do we see in terms of vaccine effectiveness in in the field setting. So we already know the vaccine is 90% effective in trials, 95% effective. That's great news. But obviously, we'll be monitoring very closely vaccine effectiveness initially, in the long-term care setting, personal care homes, and healthcare providers. And then in the second quarter, as increasingly initially individuals who are older in 5-year decrements get vaccinated and people with underlying risk factors get vaccinated. Obviously, we'll be watching closely the vaccine effectiveness in populations as they get vaccinated. But obviously, with any communicable disease, we can't achieve, community immunity or herd immunity till all of us are vaccinated. So that will start, later in the summer, continue into the fall. Younger adults, school-age children, as Mr. Livingston mentioned, may in most cases get milder illness, but can still transmit to people who are most vulnerable. And no vaccine is 100% effective. So we'll understand how effective the vaccine is, how long the effectiveness is. But obviously, we'll monitor all those things, and hopefully we can start relaxing some of the measures as we understand how effective the vaccine is over time. And we already saw that last year or this year we had a wonderful summer. Being outdoors is safer. We can certainly look forward to that in May, but with increasing confidence as we see more and more people getting vaccinated. But obviously, we'll have to see how vaccination allows us to have a very different fall and winter in 2021 compared to this year.
Follow-up, Phil?
Yes, this may be a better question for the Premier and Health Minister. And so I don't know if it's possible to get them back in, but I'll ask it of you, and you can maybe decide what you would recommend. Ontario is considering restrictions for people who refuse to get the vaccine, and I'm wondering what your thoughts are about that. Whether something like that could happen here in Saskatchewan, what your recommendations would be, and ultimately, I guess I'd like a response from the Premier and the Health Minister.
I can give an initial comment, but we can get back further details. But, we have done very well in Saskatchewan with the voluntary vaccination program. It's worked well for us for influenza and healthcare workers, people who are at risk, people who live with people who are at risk, get vaccinated for the flu vaccine every year. Our childhood vaccination rates are some of the best in the world. So we have done well with the voluntary vaccination program. But even there, when occasionally we have an outbreak, children who are not vaccinated may have to stay away. Children who are immunosuppressed and may not get the full benefit from a vaccine may have to stay home. So those are the realities, even with a vaccination program that's highly effective. So I think the same principles would apply to the COVID vaccine. But right now, the vaccine is coming in limited amounts. I'm sure there's going to be more interest in the vaccine than the supplies are, and it will remain a voluntary program for the time being.
And the Premier and Minister of Health will be available for media following House proceedings later today, so they're not available currently. We'll take our next question from the room. Colton?
Dr. Schwab, you did just mention it is a voluntary program. Excuse me, how are you going to communicate to people that they're a part of that vulnerable group? Do they just kind of call the SHA and sign up for a vaccination, or will they be communicated to that they're available for it?
Yeah, so we have, we just like with the H1N1 vaccine, like the Premier and Minister mentioned, with that we understood the epidemiology, we understood who were the highest risk, and the vaccine sequencing was done in that way. So this year, and Dr. Diener is on the call and may also want to comment. So we already know who's the most vulnerable, and that's who is going to get started with the vaccine right away in December and January. And we also know that people who are providing care to people who are most vulnerable also need to be protected for themselves and then also to protect other patients. So that's how we are starting. But then, we have looked at our own evidence, the evidence from the National Advisory Committee for Immunization, evidence from the UK and US, and it's all consistent. Offer vaccine to 80 and over initially, start coming down in 5-year decrements, 65 to 69, 70 to 75 to 79, 70 to 75, 65 to 69, as vaccine supplies allow, 5-year decrements. But then, of course, as vaccine supplies open up, 50 and older with comorbidities, and then younger than 50, with comorbidities would be important. But that's how we will have to go in a stepwise fashion as vaccine supplies allow. And I just wanted to see if Dr. Diener had any comments.
We'll go to Dr. Diener on the line.
Thanks, Dr. Shahab. Yeah, I can also just think back of the H1N1 times, where sometimes on very short notice, we just have to inform the public as to who the next cohort will be that will qualify for the vaccines. And as Dr. Shahab said, provincially, we already determined how many people more or less fit into each of these cohort groups, so that we can be clear when to move on to the next, depending on how much vaccine we will receive from the company or companies at the time. Thank you.
Follow-up, Colton?
What I was asking is, how are you going to communicate it to those people? Are you going to call them, or do they get an email, or do they contact the SHA themselves? How do they?
Yeah. So I'll make an initial comment, and Dr. Dina may have additional comments. So we obviously, we even in H1N1, for large groups of the public, it was very much communicated in the media and on our websites and through other means. Obviously, for specific target populations like residents of long-term care homes and personal care homes, frontline healthcare workers, there are other channels as well. But I'll maybe ask Dr. Diener on any further specific plans.
No, I agree with Dr. Shahab. Obviously, when we get to the long-term care and the personal care homes, it will occur within those facilities. So arrangements will be made with the facilities. The same in terms of healthcare workers. It depends on which group of healthcare worker qualifies to receive it at that time, but there will be specific communication with the healthcare workers at the time. In terms of residents based on age or comorbidity, I would assume it will occur the same way we did it more or less back with the H1N1, as Dr. Shahab said, in the media, as well as not just on the government's website, but also SHA website. That's the best way that we can probably get that information out. And as I said, it all depends on the availability of vaccines, how quickly we might have to change to the next cohort, which is a good thing. But getting the information out in the media is probably the best way for the general public. Thank you.
We'll take our next question from the phone line.
We have Lisa Schick with CJME.
Hi, I am wondering, there are about 140,000 people in that first phase of the vaccine rollout. How do you choose who in those groups get it first? Like, how do you choose who in the long-term care homes will get it first, and then later who in those 80-plus age groups gets it first and then gets it later?
Dr. Dina, do you want to take that?
In terms of prioritization, again, yeah, it will depend on how many doses of vaccine you're going to get. But as much as possible, we should probably look at the most vulnerable facilities. For example, in terms of healthcare workers, you will likely look at where people might most likely come into contact with COVID positive people. As we mentioned earlier, emerged departments, there's a large throughput on a daily basis. Our intensive care units, where we have a number of COVID positive people. We have COVID wards throughout the SHA, as well as at our COVID testing and assessment sites. So you definitely look at those at higher risk. In terms of when we get down to the general population, when you say those 80 and over, hopefully by that time, then those in the long-term care and the personal care homes are done. So we're looking at 80 plus living in the community. And that will basically, I can almost then say it's a first come, first serve basis. If it's saying, now we open to 80 plus population, then everyone in that age group will be welcomed to wherever those clinics will happen at the time. That's the best answer I can offer at this time. Thanks.
Follow up, Lisa?
Yes, I didn't see anything in this plan specifically referring to Indigenous peoples and communities, and there are some leaders who said they believe that Indigenous people should be a priority in the vaccine rollout. I'm just wondering where they might fit specifically in this plan, if at all, I guess.
Thanks. So I think Indigenous populations are a high priority for vaccination, and at this point, consistent with many other provinces, the initial emphasis would be, as vaccine supplies allow especially vaccines that are -20, the Moderna vaccine, the far north will be a priority, and then as vaccine supplies allow other populations throughout the province. But again, I think there's an age-specific prioritization, but for the far north, it may be at a lower age. We are in discussions. It may be 50 and older for the far north indigenous populations, and then as vaccines allow, there may be other sequencing as a priority for indigenous populations in the north as well. But again, I think we do see a differential mobility gaps in life expectancy in our indigenous populations, and that's really important to have an appropriate sequencing for indigenous populations as we move forward. Thank you.
We'll take our next question from the phone line.
We have Roberta Bell with Global.
Hi, in follow-up to Lisa's question, I was just wondering then, are there plans to deliver the Pfizer vaccine to remote communities in rural Saskatchewan, like Indigenous communities, First Nations, or are you waiting for the Moderna one?
Yeah, I'll make some initial comments, and Dr. Diener or Mr. Bell could add further. I think the logistics are very complex, and as you know, there's a dry run that's been happening in December. Now there's an actual run in December, a pilot with the Regina as the initial site. So we obviously need to make sure that we manage the Pfizer product very carefully initially, and as we get comfortable with the handling and secondary management, whether it can even be transported small distances, that will be the approach with the Pfizer product, but there will be limited distribution points at this point in Saskatchewan, up to 20. But then the Moderna product is -20, easier to transport for remote communities. So that will be the mainstay for more remote rural areas. Again, both vaccines, 95% effective, are equivalent in all ways. So that is the initial plan, and obviously the initial shipment is Pfizer, Moderna. Pfizer has been approved this morning. Moderna, we expect the approval to come very quickly and supplies to start increasing over January, February. So as supplies come, that the shipment of that will be coordinated with Pfizer, but it will be slightly differential. And I'll just see if Dr. Dina or Mr. Bell had any further comments.
Yes, as Dr. Shahab explained, the Pfizer product is quite complex with a -70. Also, the fact that Pfizer brings it into the specific area where it's going to be administered. So at this point in time, and things might change, but at this point in time, we cannot move the vaccine once it's been delivered to a specific location. So it's not that we can move it from the general to another clinic or a long-term care facility. It needs to stay there. There's also very complex rules in terms of dry ice, how many times a day you can open it, how long basically after opening it can be viable in the freezer, and then afterwards in the fridge. So very complex vaccine. And for that reason, it's not ideal to be used in a more remote location. So I do agree that the Moderna one would be better for transportation to those communities. Thank you.
On that vein, regarding long-term care homes, if you can't move the vaccine or it's not being recommended to move it once it comes into the central vaccination facility, how do you plan to administer it to residents of long-term care homes who are having to remain in the long-term care facility?
Yeah, I think some of those logistics will have to be worked out. Again, I think once we do the pilot in December, and Dr. Dina, please add to that, we will have to figure out a way that do we wait just for Moderna, or do we then get further information on secondary handling of Pfizer in a way that we can, at least in the 20 sites where Pfizer is coming, can we actually give it to long-term care facilities? Some of those details will have to be worked out over the next 2 to 3 weeks. And as we get experience with managing the product, and as we continue working with the public health agency and with the manufacturer. So Dr. Dina, I don't know if you had any further comments at this time, but we can certainly keep updating over the next week. We expect a weekly update on this.
It's a very good question, and that is the practical conundrum that we have at the moment. That is coming from the manufacturer, so definitely the Moderna one. would be better suited for those environments. But then at the same time, this highlighted the importance of the pilot project, where the importance of that is to test the logistics of delivery and to basically ensure that we are prepared to deliver the vaccine provincially the best we can within those practical constraints. Thanks.
And on the logistics side, is there any comment from Andrew Will on the phone line?
Yeah, I'll just echo the comments of my colleagues. I think the pilot's going to be really important for us, considering where we use each of the different vaccines based on handling requirements is one of our considerations. And certainly long-term care is one of the priorities that we know we need to have a logistical plan to address.
And we'll take our next question from the phone line.
We have Kelly Malone from the Canadian Press.
Hi, Kelly Malone from the Canadian Press. So a bit on what you were just talking about, but can I get clarification? We've talked about how the vaccine would ideally be administered in care homes and in hospitals, but what about those other priority populations, people over 80? Obviously, you can't put the Pfizer vaccine really in pharmacies. How do you plan to administer to the larger public in those populations?
So Mr. Will or Dr. Dina may have comments, but what I like to say is that on the one hand, we'll know more about secondary handling, safe handling of Pfizer. We'll get Moderna in increasing amounts. We have to remember there are potentially other vaccine candidates that are more stable at normal, 2 to 8 degree fridge temperatures that may be coming online. So we obviously have to keep our eye on the medium to long term as well, as additional vaccine products potentially are approved for use and become available. But at the same time, improve our understanding of the handling criteria for both the Pfizer and Moderna products, and as vaccine supplies improve, how they can be provided, as you have correctly pointed out, at multiple distribution sites as we move to a more population-based broader program. So with that, I'll see if Mr. Will or Dr. Dina have any further comments.
I agree with those comments. Obviously, you want to make it as accessible as possible to the general population at the time that it does become available. I think we need to keep in mind that differently from, example, the flu vaccine, where we basically have all of the product at the start of the season, and you can administer as quickly as possible at mass sites, etc. This is a little bit of a different process, with a number of doses being available at this point in time from Pfizer, as well as then from Moderna to a much smaller extent at this point per week. Therefore, it might not be to the same extent in terms of the number of clinics available, but the goal ultimately is to make it as accessible to the general population. Thank you.
And is there any clarification with the addition of the 25 portable ultra-low temperature freezers?
Yeah, Mr. Will could. Yeah.
We have Andrew Will on the line.
Yeah. So as has been mentioned, we are expecting a supply of additional ultra-low does increase our options in terms of where we're able to provide the vaccine.
Do you have a follow-up, Kelly? Kelly, we can't hear you in the room. Do you have a follow-up question?
Oh, hello, sorry. Kelly with the Canadian Press, one more follow-up. You had mentioned earlier in the press conference that the goal was to have the vaccines administered at work or in the person's community. What are some of the workarounds beyond just purchasing freezers that you're looking at, considering Saskatchewan's geographic challenges for that?
So I just like to say, and then Mr. Will and Dr. Dina can respond. We have a track record of very successfully delivering the H1N1 vaccine throughout Saskatchewan, including the far north as it came. We were recognized for that. We routinely deliver immunizations throughout Saskatchewan. We have high immunization rates throughout Saskatchewan. No part of Saskatchewan is left behind for immunizations. This is a very strong, robust program, whether it's childhood immunizations, adult immunizations, influenza campaign, the H1N1, and now with the COVID-19 campaign. So I think, can be very confident that as vaccines become available, it will be delivered in an appropriate, safe fashion throughout Saskatchewan, and we'll be providing updates as that moves forward. But I'll maybe defer to Mr. Livingston.
So the only thing I'd add before Dr. Diener or Andrew does is just remind that, phase one of our program is focusing on primary health care, personal care homes, long-term care homes, and staff that work in them, as well as staff that work in high acuity units that are exposed to COVID-positive patients, emergency rooms, ICUs. So within the first sort of quarter of next year, as we focus on phase one, and I don't want to say we have a captive audience, but we actually know where those people work and live, and it's, the geography is not as broad as the remainder of the province. But to Dr. Shahab's point, as we move through phase one and learn more about the logistics of using both the Moderna and the Pfizer vaccine, as well as looking at what other vaccines may come online that might be easier logistically, we will continue to spread out, as we do for our normal immunization programs across the province on an annual basis, to make sure that we can get those vaccinations occurring as closer to people's homes as possible. But we also want to make sure that we're doing that in a safe and a graduated way. And I just open it up if Dr. Diener or Andrew had any other further comments.
Thanks, Scott. Maybe the one piece that I would add is certainly as additional vaccines become available, we learn more about those and the requirements for handling them. And as Scott mentioned in his presentation, we do have a working group and an oversight committee that is adapting our plans as we move forward. And our goal is to make sure that we have the ability to provide the vaccine as close to home as possible for people within any limitations that the handling of those vaccines requires.
Just one thing I would like to add is the oversight committee or planning committee was mentioned earlier. Just want to make sure that you also understand that it doesn't only have representation from the ministry and the SHA, but it does also have representation from First Nations and Inuit Health, as well as NICA. So they're definitely part of the planning and can assist in the adequate distribution of the vaccines to more remote communities. Thanks.
We'll take our next question on the phone line.
We have Laura Stone with the Globe and Mail.
Hi there. It's Laura Stone from the Globe and Mail. I know you were asked this earlier, but I'm calling from the Toronto area. I'm not sure if I have access to Scrum, so I'm wondering if we can get a response to what Ontario talked about yesterday, which is the province will be providing proof of vaccination, and the suggestion that people who don't have that may face certain restrictions over travel, going to congregate settings such as theaters or cinemas, that there may be some restrictions imposed on people who do not have this vaccine. Can you comment on that?
So I'll make an initial comment and then maybe ask Dr. Diener or Mr. Will. But certainly with the influenza program, I think we do have in the past given cards, and especially if it's a 2-dose vaccine, it's also a reminder to come for the second dose. We are lucky in Saskatchewan to have an immunization registry, Panorama, which is unique. Many jurisdictions don't have this, and so that's very useful for us. But certainly, as we move forward, through the second quarter, third quarter, as we understand the vaccine efficacy, how herd immunity is protecting all of us, obviously some of those considerations may come up going forward. We can't really comment on them right now. And similarly, what will be the requirements for interprovincial international travel? Again, I think some of that is federal jurisdiction, some of that would be jurisdictions by other countries, just like right now testing. Many countries require testing before you board a flight. So I think a lot of that will evolve as we understand the efficacy of the vaccine, but also the impact it has on COVID transmission globally, nationally and provincially. But I'll maybe see if Dr. Dina and Mr. Will had any further comments.
Nothing to add from my side, thanks.
Me either. Thank you.
You have a follow-up, Laura?
Yeah, I was hoping you could talk more about the pilot project for next week. Is this something that all of the provinces are participating in? Is this something unique to Saskatchewan? Did the federal government initiate this? What more can you tell us about this pilot project?
So I can start, and then Dr. Diener or Dr. Shahab can add. So the initial COVID-19 distribution pilot is a national initiative. I'm not sure about the uptake in other jurisdictions, but certainly here we feel lucky to be part of it. And again, there are some I won't say caveats, but some things we have to work in within that pilot. So, for example, as we already mentioned, the pilot involves 1,950 doses of the vaccine, as well as the booster doses for 1,950 staff in an acute care facility to receive that vaccine. And we have targeted emergency room, ICU, and other folks on our COVID-specific units, as well as testing assessment centers. And it has a dual purpose of allowing us actually to vaccinate some of those folks on the front lines as quickly as possible, but at the same time learn more about the logistics of receiving the vaccine, how we're going to use it using sort of designated sites, but at the same time, also those learnings be transferred into how we move forward with phase 1 of our program, which is much broader, but still targeted in priority populations. So can't speak to exactly what other jurisdictions are doing, but I do believe it was a national program and it was offered to other jurisdictions. And again, we have agreed, obviously, and we'll start doing that next week on December 15th. I don't know if Dr. Diener or Dr. Shahab had anything, or Andrew have anything to add.
Sure. What I can add is it's my understanding that there's approximately 14 sites identified across the country where this pilot will occur next week. We basically already started yesterday by receiving just a shipment with a box and dry ice, so that the logistics on that part could be figured out in terms of receiving it and storing it appropriately, monitoring the temperatures, etc. And so the hope is then that the actual vaccine will be received next week, at that we can then commence with immunization. Staff who will be involved in the immunization process were already identified, and they started with some training yesterday already. And as we explained, the primary reason for this pilot is to test the logistics of delivery. This is, in my opinion, the most complex immunization plan ever conducted in Canada, and mostly have to do with the fact that we're dealing with a vaccine that's so different from any other vaccines that we've dealt with at this point in time. Usually you keep a vaccine at 2 to 8 degrees. In the past, we've had some vaccines that had to be kept in a freezer. However, this one is what we called in an ultra frozen state at -70. And because of the other logistical rules in terms of how long the vaccine will be viable once what we call the pellets are open, how many times you can open it, how often the dry ice needs to be replaced. Once you reconstitute the vaccine, the temperature needs to be kept there, and for how long. So very complex, and we want to make sure that we do everything 100% because we do not want to waste one dose. And so this is the real important part of this pilot that hopefully will start next week, is to work out all the kinks and make sure that we have a very smooth process once we receive more vaccine to immunize on a broader level. Thanks.
We'll take our last question from the room. Adam?
I was going to ask, Scott, what is the update on Parkside and the situation there? What's being done to prevent, further spread? Can you give us some numbers and some sense of that?
Sure. Dr. Schwab, do you want to just go over I think you had the latest numbers, and then I'll follow up, Adam?
The numbers I have as this morning, and they do keep changing, is that Extendicare Parkside, which is a 220 plus bed affiliated long-term care facility, as of December 9th, 141 residents and 58 staff have tested positive. So again, the complexity, we really feel for residents and their family who can't meet as much as they would like to. But this really shows the complexity of that once you get COVID into an extended care facility, long-term care facility, how quickly it can transmit, and due to no one's fault. It is something that in a congregate living setting, it is a challenge to manage it. But so far, 141 residents, 58 staff, and an additional 30 staff are in isolation as close contacts, and 11 residents have passed away. So I think it's a very challenging environment. 25 residents have been transferred to Regina Pioneer Village to reduce transmission, who were initially tested negative on transfer, but 5 have since tested positive. And so again, you have to cohort residents even if they're transferred. And so again, it's a very complex undertaking. Again, credit goes to the staff in both in extended care and other staff who are managing it. But again, this underscores why it's so important to keep COVID out of these facilities in the first place. And once they happen, obviously, it's a very coordinated response, which includes, enhanced testing, isolation, cohorting.
So, and I'll go into some of the operational stuff, Adam. So we have been working with the leadership team, both at Extended Care locally, and have been talking to them at the national level, and I'm going to get to some of those details in a minute. But from an immediate perspective, we've been supporting on the ground with staff inside the facility, both for infection control, making sure the PPE is there and being used appropriately to care for the patients. We've got respiratory therapists, some paramedics, also a number of physicians inside the facility supporting care as we speak. We've done a bunch of expanded testing inside the facility, both staff and patients. And as Dr. Shahab would have said, before those patients would have been transferred to Pioneer Village, they would have all have been tested, and they were tested and came up negative. And then when we moved them over, a number were positive. So that's why we're continuing to do the serial testing. We are starting with point-of-care testing in long-term care across the province. We've started a pilot. That pilot actually started at the Parkside Extended Care, and we will be spreading that out to other facilities, including some of the other extended care facilities. We've also been in the other extended care facilities, specifically Moose Jaw, Saskatoon already, to do audits and to help support the work that they're doing around infection control and making sure that those residents are actually receiving the care standards that we would expect from an SHA-run facility. Specifically long-term, what are we doing? We have met with the executive leadership team of Extended Care Canada, and we actually have now come to an agreement where the SHA will take a more direct role in with respect to the staffing and operations of the facility, together with Extended Care to help them support. You can imagine with a facility that is they're a designated healthcare organization, so they're not an affiliate per se, but they're a private organization that works under our standards. We want to make sure that we are in there and supporting the care of residents as much as we can, but at the same time ensuring that the standards that are being met, in such a dramatic outbreak for those patients that were there on the ground, and that's happening now. So we've signed a new agreement with Extended Care to give us that authority, and we're working with them now on a co-management model within the facility to ensure that the care that's being received and the staff. One of the challenges, as you've already heard, is the number of staff that have been impacted by this. They're really struggling bringing it in, and so we will be bringing in our teams to help support the work there.
Follow up, Adam?
On that same note, Dr. Shahab, do you think it's realistic to have people visiting at Christmas time, as was discussed maybe last week, in these long-term care facilities, given our numbers?
Yeah, in my view, this is a very challenging situation. And what we have is we have high community transmission. We have staff who are very diligent, health screening every day, very diligent, now point-of-care testing for staff and residents. And then if you say that you have a long-term care facility with 200 residents, if every resident gets one visitor, you have an additional 200 people from the community coming in. So I think the risks are very high, and I think we just need to think through very carefully. My recommendation from a public health perspective is that we be very cautious about visitation, really support the staff and the residents in staying COVID-free as much as possible, and use other ways. Remote is never as good as an in-person visit and a hug, but I think the risks are as high as we've ever had in Saskatchewan, and I think we need to be very cautious.
Thanks very much, everyone. That concludes our time for today. I'm just going to give a quick spelling and pronouncer for our officials on the line for the media. So we have Andrew Will, W-I-L-L. He is the SHA Vice President for Information Infrastructure and Support. And Dr. Tanya Diener, D-I-E-N-E-R, who is the Medical Health Officer for Immunization with the SHA. That concludes our time. Thank you very much.